staying strong, healthy, and youthful. By subscribing, liking, and ringing, you can greatly support our channel and help us produce more content that you'll love. Hello and welcome to the Longevity Lifestyle YouTube channel. Cervical cancer, also known as cervix cancer or uterine cervix cancer, is a type of cancer that starts in the cervix, which is the lower part of the uterus that connects to the vagina. Cervical cancer is one of the most common types of cancer in women, and it can be deadly if not detected and treated early. In this video, we'll be talking about cervical cancer in detail, including its causes, symptoms, diagnosis, treatment, and prevention. Causes of cervical cancer. Cervical cancer is caused by the human papillomavirus, HPV, which is a common sexually transmitted infection. HPV can cause changes to the cells in the cervix, which can eventually lead to cancer. Not all women who have HPV will develop cervical cancer, but the virus is the main cause of the disease. Other factors that can increase the risk of cervical cancer include smoking. Women who smoke are at a higher risk of developing cervical cancer than those who don't smoke. Weak immune system. Women who have a weakened immune system, such as those with HIV, AIDS, or who have had an organ transplant, are at a higher risk of developing cervical cancer. Family history. Women who have a family history of cervical cancer are at a higher risk of developing the disease. Long-term use of birth control pills. Women who have used birth control pills for a long time, 5 years or more, are at a slightly higher risk of developing cervical cancer. Symptoms of cervical cancer. In the early stages, cervical cancer may not cause any symptoms. As the cancer grows, the following symptoms may appear. 1. Abnormal vaginal bleeding. This may include bleeding between periods, after sex, or after menopause. 2. Unusual vaginal discharge. This may be watery, bloody, or have a foul smell. 3. Pain during sex. This may be due to the cancer pressing against the cervix. 4. Pelvic pain. This may be a dull ache that lasts for a long time or a sharp pain that comes and goes. 5. Urinary problems. This may include blood in the urine, frequent urination, or pain during urination. If you experience any of these symptoms, it's important to see your doctor as soon as possible. These symptoms may be caused by other conditions, but it's important to rule out cervical cancer. Diagnosis of cervical cancer. Cervical cancer is usually diagnosed during a routine pelvic exam and pap smear. During a pap smear, your doctor will collect cells from your cervix and send them to a laboratory for testing. If the test shows abnormal cells, your doctor may recommend further testing, such as a colposcopy. A colposcopy is a procedure in which your doctor uses a special instrument called a colposcope to examine your cervix. If abnormal cells are found, a biopsy may be done to confirm the diagnosis. If cervical cancer is diagnosed, further testing may be done to determine the stage of the cancer. The stage of the cancer is based on how far the cancer has spread. This information is used to determine the best treatment options. Treatment of cervical cancer. The treatment of cervical cancer depends on the stage of the cancer and the woman's overall health. The main treatment options include 1. Surgery. Surgery may be used to remove the cancerous cells from the cervix. In some cases, a hysterectomy may be done to remove the uterus and cervix. 2. Radiation therapy. Radiation therapy uses high-energy radiation to kill cancer cells. It may be used alone or in combination with surgery or chemotherapy. 3. Chemotherapy. Chemotherapy uses drugs to kill cancer cells. It may be used alone or in combination with surgery or radiation therapy. 4. Targeted therapy. Targeted therapy is a type of treatment that targets specific molecules in cancer cells. It may be used in combination with chemotherapy or radiation therapy. The choice of treatment will depend on the stage of the cancer, the woman's age and overall health, and whether she wants to have children in the future. In some cases, a combination of treatments may be used. Prevention of cervical cancer. There are several ways to prevent cervical cancer. 1. HPV vaccination. The HPV vaccine can help prevent the types of HPV that cause most cases of cervical cancer. The vaccine is recommended for girls and boys ages 11 to 12, but it can be given to people up to age 26. 2. Pap smear. Regular Pap smears can detect abnormal cells in the cervix before they become cancerous. Women should start getting Pap smears at age 21. 3. Safe sex practices. Practicing safe sex can reduce the risk of getting HPV and other sexually transmitted infections. 4. Quit smoking. Quitting smoking can reduce the risk of developing cervical cancer. 5. Regular checkups. Women should have regular pelvic exams and Pap smears to detect any changes in the cervix. Conclusion. Cervical cancer is a serious disease that can be prevented and treated if detected early. Women should be aware of the risk factors and symptoms of cervical cancer and take steps to prevent the disease. Regular checkups, safe sex practices, and the HPV vaccine can all help reduce the risk of cervical cancer. If you experience any symptoms of cervical cancer, it's important to see your doctor as soon as possible for testing and treatment. Thank you for watching, and we hope this video has been informative and helpful. I recommend that you watch all the videos I upload from the beginning to gain a comprehensive understanding of the topics covered. Don't forget to like and subscribe to our channel for more videos on health and wellness. See you in the next one.